So the term mobile devices here refers to a number of types of handheld and mobile computers, but it most frequently is referring to mobile phones. And this is going to include smartphones, which are handheld computers that run a complete operating system, and it can function as a platform for app developers. And also, we're talking about feature phones. So these are mobile phones that have less computing capacity than smartphones. So the popularity of mobile phones has really increased dramatically in recent years. Global penetration of mobile cellular subscriptions, this has reached 87% and currently stands at 79% in the developing world, with about 6 billion mobile phone subscriptions worldwide. So we have mobile broadband subscriptions, which have grown 45% annually over the past 4 years. And then today, there are twice as many mobile broadband as fixed broadband subscriptions. So, given the widespread use, the ease of use, the portability, and the high level of computing capacity of even basic feature phones, these technologies offer a really great potential for just affecting the public health and healthcare delivery. So these mobile devices, they can be used for a wide variety of therapeutic purposes, including collection of mobile, like the mobile data collection. These tools are used to obtain data about users' emotional states and their behavior in real time. So, ecological momentary assessments. Short messaging services, or SMS, is also known as text messaging or texting, which typically is going to allow for a very limited amount of data to be transmitted. It's usually between cell phones. SMS is really easy to use and it allows for data to be entered into a database and monitored in real time, which in turn facilitates the sending of messages that are going to encourage that client recipient engagement in health promotion or treatment related activities. Then we have applications which are embedded on the mobile devices, and these are accessed on servers like mobile devices that can provide in the moment interventions that are designed to reduce that health risk behavior. And although there are a lot of apps that are accessed primarily on mobile phones, these software programs are accessible on a lot of different types of hardware, including tablets and even some computers. So the use of these mobile devices for collecting data in real time has really led to a huge advance in understanding the behavioral states of individuals. So collection of this real-time data via these devices can provide data that are more accurate than the data that was obtained via retrospective recall. So data collection via these mobile devices in real time is also going to offer the opportunity to provide in-the-moment intervention in response to these participants' behavior state. It's going to address their mood, their medication regimen, their compliance status, maybe their symptoms or their functioning. So, offering this evidence based intervention via the mobile device and some of the apps that are on there is going to hold great promise for enabling access to behavioral health services that's outside of that formal treatment setting. And when these individuals may be most likely to engage in their risky behavior. So, participation in therapeutic activities is when it's inside of that natural environment and outside of the formal system of care, it's probably going to enhance the outcome. And it's going to enable more generalization of skills as applied in the real world setting. So, the scientific literature on mobile phone based interventions, although it's limited to today's date, it's going to suggest that it may hold great promise. One sided text messages, for example, from the provider to the consumer, have shown considerable utility in promoting treatment compliance. This is for like asthma, diabetes, medication management, and so on. And also self monitoring of their health behavior like eating healthy and exercise. So these text message prompts can also significantly improve attendance at their medical appointments and compliance with their vaccinations. And then, these prompts, they show promise in weight loss and HIV risk reduction. So we have more recent developments in mobile technology that enable the continuous tracking and monitoring of all this health information, as well as some interactive programming on mobile phone platforms. And then also, two-way text messaging might allow clients to input data that lead to in the moment interventions that are delivered in real time. And it's going to help them to connect with the behavioral health service providers in all types of settings. So, this technology has facilitated the development of more sophisticated mobile interventions that are really helping to promote behavior change. So, one example of using advances in programming and adaptive algorithms to permit the apps to select content based on the individual's characteristics and their prior responses is a program that provided text messages and other information to employees with diabetes. And that enabled each employee to regulate the number of text messages that they would receive. So, by being sensitive to how an employee felt about the number of text messages received, the researchers hope to build engagement with and acceptance of the program and its use. And then evidence showed that their client centered efforts worked. Many participants were happy to receive several messages a day, with one employee saying that the messages made him feel like he didn't have to handle the complexities of his diabetic condition entirely on his own. So, PTSD Coach, this is an app that was created by the VA's National Center for PTSD and in conjunction with the U.S. Department of Defense's National Center for Telehealth and Technology. So this particular app, it helps users to learn about and manage their symptoms that commonly occur after trauma. This is just one example of an app that's out there that can help manage and track the symptoms of a mental health disorder. Um, some of the features are reliable information on PTSD and treatments that work, tools for screening and tracking the symptoms. It's a convenient, easy to use skills program to help clients handle their stress symptoms. It provides direct links to support and help, and it's got continuous accessibility. This app is available to clients when they need it, wherever they're at, so long as they have appropriate enabled device. So together with professional treatment, PTSD Coach provides the clients who have or they might have PTSD with dependable and trustworthy resources. Family and friends can also learn from this app. So, back in February of 2014, this particular app had been downloaded 138,000 times in 84 countries. We also have text based smoking cessation apps or cessation apps. So, these text messaging interventions are going to be on the mobile devices and it increases the smoking cessation, especially among higher income individuals. So there's one that's text to stop. This is an intervention using text messaging. So they get 5 texts a day for 5 weeks. And at a 6 month follow up, they found that 10.7% had continued abstinence, as opposed to the standard smoking cessation services, which only had a 4.9 continued abstinence at their 6 month follow up. So these uh, methods, these interventions, they are showing that they are working. Significant developments in technology just continue to emerge and offer some really great promises for integration into behavioral health services. Ubiquitous computing, which is sometimes called umbicomp or pervasive computing, and ambient intelligence are really rapidly evolving fields in which the human computer interactions are embedded into everyday objects and activities. So, ubiquitous or pervasive computing is typically referring to the technologies that we weave or that are weaving themselves into the fabric of our everyday life until they're indistinguishable from it. So, for example, ubiquitous computing technologies may include sensors to assess psychological states. And these sensors are worn by individuals on their bodies or they're embedded within mobile devices that allow the unobtrusive and objective measurement of these psychophysiological states, as well as biological and environmental variables. So, in real time, via the interaction between the sensors and the mobile computing devices. One example of this approach is a suite of wearable sensors that collects and processes the cardiovascular, regulatory, and thermoregulatory measurements to kind of infer stress as individuals move through their daily lives. Other sensors infer physical activities, social interactions, and behavioral risk factors by capturing and interpreting a variety of characteristics of speech via the smartphone. So in 2011, Barnett, Tidy, Murphy, Swift, and Colby conducted a pilot contingency management study using a transdermal alcohol sensor that measures the very small amount of ingested alcohol that's excreted through the skin. So the Secure Continuous Remote Alcohol Monitoring Bracelet, or SCRAM, uh, used in this pilot study is being used in veterans treatment courts, including the Center for Substance Abuse Treatment, which is and Justice for Vets Collaborative um, Mentor Court in Tulsa, Oklahoma. Ambient intelligence, this is referred, or it's referring to an intelligent environment or an intelligent service system that can anticipate, adapt to, or meet the user's needs. Although these evolving technologies like smart homes, they've only just started to be applied to behavioral health, they could have a marked impact on the field, incorporating many of the technologies already available and in use. So these approaches could allow for real-time, unobtrusive psychophysiological measurement and on-demand continuous access to tailored support, education, and interventions that target behavioral health. So for example, UbiComp tools, they can obtain real-time data on physiological and environmental factors that precede and follow risk behavior or healthy behavior. And it can provide the in the moment intervention that is responsive to these factors. So these tools, they may be able uh, to enable unprecedented levels of, of tailoring for individuals over time. But these efforts will, of course, they're going to require careful consideration of issues related to disclosure and consent and privacy. We see the um, ubiquitous computing in our smartwatches or those watches that monitor your pulse and your heart rate or your step counters or I've even seen um, things that monitor your sleeping patterns and how much you're snoring and what your oxygen is. My baby had, I believe it was called an owlet, where it was kind of like a little sock that you put on the baby's foot to monitor the baby's oxygen levels while the baby's sleeping. Then this is, I guess, created to prevent SIDS in infants. So let's talk about emerging technologies and some future opportunities here. Um, One of the things that we can talk about here is virtual reality. So the term virtual is often going to refer to anything that takes place online rather than in the real world. But for the purposes of this training, virtual reality or VR is going to refer specifically to technology that is reproducing realistic conditions and or computerizing the certain aspects of monitoring or data collection. So the use of VR in helping veterans with PTSD is just one glimpse of the type of future progress that might be achievable with these new technologies. VR is going to allow the users to visualize and manipulate and interact with the computer and some highly complex data. So, extensive and promising work has been conducted for more than 15 years in the use of VR to treat combat related PTSD. So, comparing VR with the use of aircraft simulators to train pilots, Brennan in 2013 described VR's ability to create context relevant simulated environments where assessments and treatment of cognitive, emotional, and motor processes can take place, extending the skills of the clinician by allowing the clinician to precisely and systematically deliver complex, dynamic, and ecologically relevant stimulus presentations within which sophisticated interaction, behavior tracking, performance recording, and physiological monitoring can occur. So, in addition, we have more than 190 clinical trials that related to virtual reality and exposure therapy for PTSD and other health related uses of this VR. The Army's immersion VR system has produced advances in measurement capabilities, like the development of a measure for the stress indicator, which is referred to as allostatic load or AL. Allostasis is how the body tries to maintain stability in the face of acute stress. So, the Army has used VR to develop a measure of AL based on inflammatory, metabolic, cardiovascular, adrenal, and renal systems in the body. So, Brennan in 2013, he says AL gauges the cumulative negative impact of the stresses of daily life. It indicates how a person is influenced by such stress in the long term. So, this concept of AL has led to research on the differences in how people experience stress and on possible measures of resiliency to stress. So, the use of VR for research and treatment may not only expand the range of knowledge and the options that we have for treatment, but it can also lead to a higher level of understanding and experience that has been possible in the past. If you want to check out some of these clinical trials, you can go to clinicaltrials.gov. That search engine, as of 2014, May of 2014, it yielded 190 clinical trials on VR with research in exposure therapy for PTSD, stroke rehabilitation, balance training exercises for older adults, weight loss, medical and scientific training and education, like what are the effects of marijuana. It also included wearable sensors and other physical conditions like pain and memory conditions or behavioral conditions like anxiety and social phobias, agoraphobia, panic disorder, autism spectrum disorder, ADD or ADHD, smoking cessation, and also a fear of flying. This ever widening range of technology based therapeutic tools becoming available might seem really daunting as you're attempting to determine which tools are going to be the most useful in providing technology assisted care to your clients. So, this lesson is outlining several issues to consider when we integrate these electronic technologies into our work. First and foremost, you need to maintain awareness of the scope of your professional competence and work within its boundaries, even as you explore TAC approaches. It's also important to understand which technology based therapeutic tools have been shown to be the most effective, as not all such tools have both evidence based content and evidence based guidance for use. An ethical behavioral health service provider is going to consider the available evidence supporting the incorporation of a given uh, technology-based intervention into their clinical practice. So rather than just use technology-based interventions just because the opportunity exists, we need to review these interventions to ascertain which have been showing to produce optimal outcomes in contexts that are similar to those in which you're going to be working. Additionally, these types of technology based tools that are going to be most useful are going to depend on the audience that's being targeted and the settings in which we're going to be using these tools. So, for example, a self directed technology based intervention and asynchronous forms of technology based communication might be particularly useful with specific subgroups of clients, such as those with like social phobias. So the same types of technology-based interventions, they may elicit more honest communication with clients due to the perceived anonymity or confidentiality that they enable. And the clients may feel more comfortable addressing particularly sensitive topics in front of a computer screen or a mobile device than during in-person communication. Asynchronous communication and self-directed technology-based tools can be really useful to people who don't routinely have access to that private space where they can talk on the phone or through VoIP to a clinician, but they do have access to the computer or the mobile device. So in some cases, however, the use of technology in therapy is going to be contraindicated. So for client populations, that's going to include individuals who are experiencing significant emotional distress or some complex situations like domestic violence. These counselors, we have to give careful thought to how we're using the technology appropriately to enhance care. Clients who are actively suicidal or homicidal or severely emotionally distressed might not be good candidates for online care. We want to keep in mind that self directed and asynchronous tools cannot convey your client's nonverbal cues. Like, are they intoxicated? Are they crying? And they may not be ideal for clients who find uh, typing difficult or frustrating. Clients who are isolated and they crave that social interaction or they feel the need to get out of the house, they may not be good candidates for technological interventions that decrease the in person contact. By contrast, self-directed and asynchronous tools may be particularly appealing to teens and young adults who have grown up on the internet and they spent most of their time interacting with some technology. A Kaiser Family Foundation study found that the exposure to media of children and teenagers 8 to 18 years old increased roughly 20% from 2004 to 2009. So, estimates of the amount of total recreational use of all devices per day, every day of the week, reached almost 7.5 hours in 2009. And then several studies underscore the acceptability and the appeal to use over the computer delivered interventions relative to more traditional models of care. So, for example, among the most significant barriers to adolescents' participation in substance use disorder treatment is a dislike for their counselor, discomfort in talking about their personal problems with another person, and they just found counseling unhelpful. As a result, these computer-based counseling may be appealing to youth. Youths may prefer internet-delivered substance use disorder interventions over more traditional interventions. A lot of the youth report that they find interactive computer learning environments preferable to traditional learning environments in that computer-based learning allows them to solve problems actively and independently while still receiving that individualized feedback. Also, there's a growing body of research that's highlighted the utility of technology for health promotion among the aging populations, including the promotion of health related knowledge and functional longevity. Also, computerized cognitive remediation tools that are designed to enhance cognitive skills through exercises that target the problem solving the attention, the memory, and the abstract reasoning have shown to have promise in populations with SMI, as well as among individuals with substance use disorders. So, a key benefit of telephone based counseling is the accessibility of phones, including cell phones, to a number of populations. So, phone based counseling has a broad appeal and utility. It is important to add that the use of technology, just for technology's sake, does not help the clinician or the client. Any use of technology should engage both the clinician and the client, making the use of time more effective and valuable for both people. Now let's jump into legal and ethical issues that we need to consider. So, ethical considerations in technology assisted care are often extensions of, and in many cases, they overlap with the ethical considerations in our traditionally delivered behavioral health services. However, some unique considerations are going to arise for TAC. As clinical practices are going to differ in various settings, it's not possible to cover every possible ethical and legal consideration relevant to the incorporation of technology into the behavioral health services. And with that being said, this particular section is going to address some of the most significant ethical and legal considerations when we provide the technology assisted care. So, the use of these technology based therapeutic tools in behavioral health is going to warrant a number of considerations that are related to confidentiality, privacy, and security. And as in traditional clinical scenarios, ethical principles and procedures related to protecting the client's privileged information, which is confidentiality, and then their privacy or protecting their rights to control and access their information, and also protecting the client data from being accessed without authorization or our security. These are of paramount importance. However, there's some unique considerations that are going to arise when collecting data or delivering interventions using this electronic media. So, text based communications are going to provide a literal transcript of communication between you and your client. So, you got email, online moderated chat forums, or among groups of clients, so like online support groups. But this mode of communication is going to pose a certain risk. So, for example, if a mobile device is used for communicating with a client via text messaging, depending on the settings and the device properties, these messages are stored on the mobile device as well as those sent from the device, and they're likely unencrypted and vulnerable to security threats. Email messages are also usually unsecured, and they can be accessed by third parties. Even if the emails are deleted by both you and the sender, then I'm sorry, you and the recipient, then they may be preserved by other third parties like the internet service providers or your ISP. A thorough discussion of the broad set of security issues related to the use of mobile devices in the general healthcare environment is really beyond the scope of this training. Um, but the FDA, the US Food and Drug Administration, has been issuing some guidance as to which sorts of technologies are going to be considered medical devices and which are considered health or medical apps that don't require approval from the FDA as medical devices. But in general, we know the apps that pose lower risks to the public are not going to be required to seek review as medical devices. So in 2014, the FDA has described some of these low risk devices as apps that help people maintain their coping skills, alert people with asthma of potential environmental conditions, that prompt users to check on possible drug interactions with food or herbs or other medications, um, apps that use videos to motivate the patients to do their physical therapy at home, or apps that provide information on screening, counseling, and preventive recommendations from these well known and established authorities. Apps that enable a clinical conversation to be recorded for the review after the visit. And then also apps that allow users to track behaviors related to their diets, their exercise, and their sleep. And lastly, apps that engage in mind challenging tests or games. these are not going to have to seek out approval from the FDA. But these apps um, that may constitute a risk to patients or others if that device fails to work properly are going to require approval as medical devices. So, for example, certain devices are going to relay heart function data to medical services that monitor a patient's heart functioning. And if such a device provided false information or failed to operate, it could really endanger the patient. So, the healthit.gov website, um, it's operated by the Office of the National Coordinator, the ONC, for Health Information Technology. And it offers a number of resources for healthcare providers related to using these mobile devices in a way that can help protect and secure client health information. So, for current information on app security issues, you might want to refer to the HIMSS website. This is www.himss.org. New information about the regulation of these mobile medical apps is rapidly developing. The FDA website lists examples of mobile medical apps that it will and will not seek to regulate. So, for a detailed overview of these issues related to the regulatory framework emerging for this digital medicine, including the developments outside of the United States, um, there's a research study in 2015. Ellen Coe, Spear, and Zohar, they provided a cogent review and analysis. In the US, text based communications between providers and clients are protected under HIPAA, and some state laws that cover protected health information, PHI, but they can be subpoenaed from providers or the ISPs. So, this text based communications between a counselor and a child or an adolescent are going to pose unique risks, as parents typically have a legitimate right to review their children's medical records, which may include some types of communication. And HIPAA doesn't explicitly address the use of some technologies like SMS or cell phones. But there are several guidelines regarding the clinical use of these technologies that are available, including the National Institute on Standards and Technologies Guidelines for Mobile Data Security, which addresses some potential security issues that must be managed when we're using these devices for the therapeutic process, and the ONC website on privacy and security for providers and professionals. So, for example, the subscriber identity module card on a mobile device stores text messages and identifies users of cell phones to the cell phone network. This raises important questions regarding the physical security of the mobile device, along with the importance of encrypting your text messaging. Encryption is available for telephone communication as well, although it can be very cost prohibitive. VoIPs, which enable phone communication over the internet, typically allows for more accessible encryption technology. There is an option with increased security, and it's the use of secure web-based messaging systems that's going to allow providers to email clients with a prompt to log into a password-protected website to retrieve a message, rather than sending the message through multiple servers as with a normal email. So you may wish to set up a password protection, automatic logouts, firewalls, audit trails, encryption, and authentication for any programs that you want to use. Also, you need to consider whether to include transcripts of any electronic communication with your client in their client records. Online counseling services are going to allow for tracking of the client's internet protocol address. This information does not automatically reveal the exact geographic location of the client, but an ISP may be able to provide such information in an emergency. So, large online counseling service providers often use proprietary systems for communicating with their clients. These systems may include encrypted chat stream identifiers, storage of text communication with the clients, and emergency procedures for locating a client's local hospital or police station, which can effectively help to manage several of the confidentiality issues that we've reviewed thus far. Ascertaining the security of technology based communication between the provider and the client is really important, given that third parties can potentially access some of this communication. And with that being said, the largest risk is typically low tech and includes sending an email to the wrong address or posting one's password in a place that's visible to other people, forgetting to log off, or using an employer hosted email server. There are a number of legal considerations that are related to this online counseling model. Interjurisdictional issues like licensure laws and regulations that apply when practicing across state lines, for example, they have to be understood. So, state licensing boards typically require that a practitioner providing services in a different state also has a license to practice in that state. States also vary in their mandatory reporting laws, such as those related to concerns about abuse of and or harm to self or others. Also, you should be aware of any ethical standards or guidelines regarding online counseling models provided by professional organizations. You should further be aware that online counseling best practice guidelines may vary with specific systems and tools that you use to deliver TAC. As technology and ethical issues continue to evolve, it's important to obtain professional training and certification. Clear policies should dictate the use of this various technology to communicate with our clients. So establish your own policies that are in compliance with your organization's overarching policies that are based on your understanding of the risks and the benefits of these various approaches, and clearly communicate this policy to all clients. Ideally, these policies would differentiate between what constitutes PHI and what does not. Many professional organizations are going to offer standards and guidelines in this arena, and it may be able to help you formulate your own policy as well. So, these policies on the use of communication technologies should address issues such as which technology providers are willing to you're willing to use in communicating with your clients, when each technology is and is not appropriate for use, and what are the potential risks and benefits of using each technology. Um, these policies should also cover the extent to which other staff members in a clinical practice may access the technology based communications with our clients. These policies should also additionally ensure that our clients don't assume that there's going to be any real time communication with the clinician. So this should be like a policy to inform clients that they should not use the technology based intervention to contact the clinician when they're in a crisis state, like when they're experiencing suicidal or homicidal ideations, or making plans, or exhibiting intent. All providers should put their TAC policies in writing and clearly communicate them to clients at the start of the therapeutic relationship using the informed consent agreement. It's also helpful to have clients sign off on these policies to acknowledge that they have reviewed them and they agree to comply with them. Providers of this technology assisted services are bound by these same legal and ethical requirements and standards of practice that apply to the in person service delivery. But technology introduces some additional risks and benefits that should be covered with our patients in these technology assisted services. So the risks and considerations are going to vary by the type of technology used as well as the services that are being delivered. And although internet and mobile phone access is rapidly increasing all over the world, some populations may have greater access to these technologies than others. Variables that influence access are going to include rural versus urban locations, socioeconomic status, various demographic characteristics like age. Even with access, some people may not be able to engage in technology assisted care readily due to their challenges with technological literacy or health literacy or even reading literacy. Additionally, there are some technology based tools and interventions that may not be accessible to or even perceived as useful by these various groups if they don't address that particular individual's need in a culturally responsive manner. Clients will benefit from these tools that are in the language which they have the greatest faculty. Technology assisted care is going to offer a great potential to lessen the digital divide and address healthcare disparities that exist in many traditional models of care. So, for example, um, although white Americans, 80%, are more likely to use the internet than African Americans at 72%, or Hispanic Americans at 61%, African Americans are the most active users of the internet via mobile devices. So, this rate is going to increase in the use of mobile devices to access the internet among minority groups. And it has, since 2007, remained at roughly twice the national average. So, for example, 141% increased use for African Americans versus the 73% national average. So, by offering interventions on a wide variety of platforms to capitalize on the technology that's most frequently used by these various target populations, like developing interventions for mobile devices for specific minority groups, this technology assisted care may offer a new service delivery model that could substantially reduce the healthcare disparities that are present in many traditional care models. So, for examples of the use of TAC or TAC with Native American populations, um, there's a tip by SAMHSA called Behavioral Health Services for American Indians and Alaska Natives. So, feel free to check that one out. Technology based therapeutic tools not only offer clinical information and support to these diverse audiences, but it's also going to provide social and supportive functions that may be absent or inaccessible to certain populations via the traditional healthcare system. And because TAC can provide information tailored and responsive to each individual's level of understanding and needs, this approach can accommodate diverse users with different cultural needs and varying levels of health or technological and reading literacy. Then we have legislation and policy changes that could soon promote broadband access and digital competence. And that's going to help to reduce the digital divide. So, for example, on May 28th, 2015, the Federal Communication Commission, or the FCC, they received proposed changes to the Lifeline program, which has existed since the mid 1980s. And it was originally designed to help people with low incomes pay for phone services. But proposed changes would have allowed the program to support broadband access for low income individuals. We've seen more households with incomes of $150,000 or above. They have easy access to broadband services, whereas slightly less than half of the household with incomes below 25,000 can access these services. Moreover, almost half of the low income families have had to cancel or suspend their smartphone services due to the cost. And then as of June 2015, there were drafts of proposed legislation that were introduced into the US Senate, the Broadband Adoption Act and the Digital Learning Equity Act. Passage of those types of legislations and related policy help to narrow that digital divide. And even today with the Lifeline program, and there's other programs out there, I've seen more recently because of COVID, they've kind of geared up their efforts to reduce the digital divide. And they are providing stipends or reduced bills or free internet for individuals. I've seen a lot of companies promoting the free internet services for very low um, gigabytes or speeds for family members, just so their children could have access to these online classrooms because of the the need for the digital learning because of COVID. Another important consideration in using technology based therapeutic tools in the behavioral health arena is EHRs, electronic health records. These are also called electronic medical records or EMRs. These terms are often used interchangeably, but an EMR, it's typically going to refer to the individual's patient record that's created in a single healthcare setting, whereas the EHR typically collects data cumulatively across healthcare settings. So EHRs are part of the larger effort to kind of promote that meaningful use of health information technology. It's going to improve healthcare and enhance the information exchange among the healthcare providers. Um, the Health Information Technology for Economic and Clinical Health Act of 2009 and the Patient Protection and Affordable Care Act of 2010, they both emphasize the widespread and meaningful use of EHRs and are intended to improve record keeping. Um, they're intended to improve the outcomes of reporting, patient transitions across providers along with their medical records, and quality of patient care by increasing the communication across the providers and reducing any medical errors. The three main components of meaningful use are the use of a certified EHR in a meaningful manner, the electronic exchange of health information to improve quality of health care, and the use of certified EHR technology to submit that clinical quality measures and other measures. Research and development efforts with EHRs are rapidly expanding in the US and also elsewhere. We have a complete, I'm sorry, we're not really going to be able to go into a complete review of all the EHRs. That's just beyond the scope of this training. But the evolution of EHRs and their application in healthcare settings are really well characterized in a number of existing resources. Um, so you can look on healthit.gov or ahrq.gov, the Agency for Healthcare Research and Quality, and the ONC for Health Information Technology. They both provide details on EHRs online. These EHRs, they're going to offer a really considerable promise for collecting data on clients' behavioral health along with other medical issues, which may enhance the client centered care and the public health. Limited work to date has really focused on the integration of these EHRs that include behavioral health data with other technology based therapeutic tools that target behavioral health. Combining them may markedly influence behavioral health services. So, for example, web based or mobile interventions that collect data as a part of the screening or assessment activities could code those data in a format that is compatible with EHRs and then interface with the EHRs to update relevant information. Such data would really provide a richer, more comprehensive picture of the client's behavioral health, and information collected on a client's behavioral health in real time via a mobile app might even allow for a better characterization of that client than information that's collected only during an in person appointment with a behavioral health service provider. And at this time, there are no national standards for the collection of data on clients' behavioral health, and incompatibility among the different types of EHRs is really going to impede the efficient sharing of data. Really little research to date has really focused on the effective strategies for integrating this data from the technology based therapeutic tools into these EHRs. However, SAMHSA, the National Quality Forum, Health Language Inc., and several other groups are really working to kind of fill in these gaps. So, for example, several institutes at the National Institute of Health in collaboration with the Society of Behavioral Medicine, have launched an initiative to identify common data elements for client reported measures of behavioral health, which can be used in EHRs. These common data elements, such as measures of quality of life, eating patterns, substance use, anxiety and depression, and stress, these can be used in primary care and public health settings to kind of screen clients for their behavioral health risk factors. And doing so could lead to a number of possible benefits. And some of these benefits could include uh, improved clinical decision making, like with a greater involvement of clients in shared decisions, and delivery of tailored brief interventions in these settings. Emerging research and development efforts will be especially important as behavioral healthcare is increasingly integrated into other healthcare settings, and as a result, is less confined to specialty treatment programs. So, for example, the 2010 National Drug Control Strategy from the White House the White House Office of National Drug Control Policy, the ONDCP, they set several goals to integrate treatment for substance use disorders into an array of healthcare settings and not really confine such treatment to specialty addiction treatment programs. And it's these goals, as well as additional goals to increase the integration, that have continued to be a part of ONDCP's strategies. A key strategic action is to meet the goal is going to involve expanding the addiction treatment into community health centers or CHCs and other settings that service these low income populations that are most in need of our treatment for the substance use disorders and their mental illnesses. A critical issue is going to be maintaining the specifications of Title 42, Part 2 of the Code of Federal Regulations. That's the confidentiality regulations that govern privacy and confidentiality of records that are related to the substance use disorder treatment. So, these technology based approaches to assessing clients' behavioral health and the evidence based interventions that are responsive to the client's behavioral health risk factors, these might enable the clinicians to conduct these activities with excellent fidelity and at a low cost for a broad base of clients. The flexibility and the ease of use of technology delivered approaches can really promote that access to behavioral health services for those hard to reach populations who use these community health centers, and also to other non specialty healthcare settings for other medical services. As a technological infrastructure is going to allow for the collection and storage of the select client data, this is going to improve our coordination of and our continuity of care and activity reporting that's going to facilitate our service reimbursement. And these technology based tools are also growing in terms of self help techniques entirely outside of any formal healthcare related activities. So many health promoting apps suggest, but don't require coordination with healthcare professionals. It's kind of too early to tell which technology based tools may be helpful as standalone, wholly self directed interventions, and which may facilitate coordination and cooperation. Whatever the future holds, technology assisted care is especially likely to enhance the capacity of primary care organizations to attend to the behavioral health needs of their clientele. Information in these EHRs are going to help clinicians to manage their health care. So I want to kind of talk about a couple of these EHRs that are out there. Athena Health, um, this particular service is a cloud based service for electronic health records. You can do revenue cycle management and medical billing, patient engagement, care coordination, and population health management. And Hippocrates and other point of care mobile apps are congruent with this particular service. They work with more than 160,000 providers, and this EHR is going to offer a homepage that allows the users to review the daily schedule and also the patient information, manage their orders, and view incoming lab results. The billing module can be used in tandem with the EHR or on its own, and it's going to feature a patented and continuously updated rules engine. Medical practice management tools include visibility into daily responsibilities, custom benchmarking, proactive trends analysis, and a lot more. And the patients can utilize a patient portal to review history, pay bills, sign forms, schedule appointments. Reminders can be delivered via the phone, email, text messaging, and patients can even be alerted when their test results are waiting in the patient portal. Another one called RxNT. It's an integrated suite. It's a certified EHR, practice management, and billing software. It's going to optimize those clinical outcomes and revenue management. It's a simple, transparent pricing. It doesn't have any hidden fees. It includes free setup and training, free data transfer, free in-house support, and free regular system updates. So this is a cloud-based iOS and Android mobile and tablet apps allow the providers to e-prescribe, manage their patient information, charge, capture, schedule providers and practice resources, and even check in patients from anywhere. Um, so, this particular service improves patient care and it streamlines that clinical management. Also, one really in particular one for the state of Georgia is Georgia's Unum, UNUM. It's through Aiden Corp, ADEIN Corp. Um, it's an online client and document management service that's designed for treatment providers. Everything in Unum is internet based, meaning nothing needs to be installed or downloaded on the computer to use this particular program. This application makes the treatment process with a client virtually paperless as well. So there's online document generation, the ability for clients to electronically sign things like releases of information, and also document sharing that's available through the program. And there's also many built-in behavioral health assessments that you can request that your client take as part of their treatment. So associates like parole and probation officers can also join Unum, and then they have the ability to share and receive documents from providers as well. Um, so it's going to put all of your client records in one place. In addition, if you are a provider with Georgia's Department of Behavioral Health and Developmental Disabilities, or DBHDD, for whom Unum was created, then all providers are in one place as well. So if at the end of your treatment process with a client, you determine they require further treatment, they can then select another provider and be transferred to them within Unum. One issue with this is they charge per client. It is a very easy way to disseminate this information without having to collect a bunch of people's addresses and fax numbers and so on and so forth. You can just find their provider or their information on the Unum system and send it. But if you do the evaluation and then somebody else in your facility is doing the treatment, then you have to pay twice for that client because one is uh, an evaluation record and the other one is a treatment record. So you're paying twice per client with this particular service. Um, some people have opted in for it because of its ease of use, especially if you're dealing with the DBHDD. Um, and then others have moved on to other electronic health records. But the state is now requiring for DUI providers to have an electronic health record. So these are a requirement if you are a DUI provider for the DUIIP or the Georgia DUI Intervention Program. If you have any questions, please feel free to put them in the chat in the lesson and move on to the second section of this training.